Okay, so I'm doing my case study on bronchopulmonary dysplasia. So the patient demographics, my patient was 3 months old, born at 25 weeks premature, so corrected age, he was a week old. Height and weight, he was 45 centimeters and he was 3.4 kilograms. BMI was 16.62. He was on zero point 0.5 liters of oxygen. Had no known allergies. Diagnosis was bronchopulmonary dysplasia, and he was a full code. So, growth charts. So, because he was 25 weeks and the corrected age was 1 week old, for months in age, it was 0. And so that puts him in the fifth percentile for height. And for weight, that puts him at the 40th percentile-ish, somewhere between 25 and 50, but closer to 25 because his weight was 3.44. His BMI was 16.62. And so this is the combined chart, and you can see the lines. So this is it for weight here. And then for height, he's 45 or 40, yeah, 45. And then nutrition wise, he's been getting every 3 hours, he takes a bottle, and he took the bottle really well. He finished all of it, and he's been drinking 2 ounces of Enfamils and Vicare. So, what is bronchopulmonary dysplasia? Bronchopulmonary dysplasia, or BPD, is a form of a chronic lung disease. This is when the lungs and airways are damaged, causing tissue destruction in the tiny air sacs of the lung. So the affected population, so it's mainly in premature infants, and the majority of newborns who develop BPD are more than 10 weeks early, and my patient was 15 weeks early. And I'm unsure how much my patient weighed at birth. And my patient was a twin, and their twin also actually had BPD. So both babies born at 10 weeks or at 15 weeks early had BPD. And yeah, so signs and symptoms. So tachypnea, which is an accelerated rate of breathing and increased work of breathing. So like nostrils flaring, using accessory muscles, grunting while breathing. At the beginning of my shift, actually, he was so tachypnic and he was using his entire body. We had to call the doctor. Frequent other signs and symptoms are shortness of breaths, apnea, and wheezing. So this is just related genetics to BPD. So a recent exome sequencing study pointed to rare variants implicated in BPD. The genes harboring these rare variants were enriched for lung development pathways. 2 independent twin studies have been shown strong heritability underlining BPD. However, the genetic architecture of BPD remains unclear. Candidate gene studies identified a number of genes potentially involved with the development of BPD, but the etiological contributions of each gene is not substantial. I found the second one interesting because my patient was a twin. Diagnostic tests that are run are blood tests, x-rays, echoes are all used to diagnose BPD. Also, premature babies who need oxygen for more than 28 days are considered to have BPD because they're so dependent on the oxygen, and BPD is so common amongst preemies. So how to manage the disease. So oxygen is given because the lungs did not fully develop. So the oxygen saturation rate of the kids is not high enough to sustain on their own. So the lungs cannot supply enough oxygen. So supplemental oxygen is required, and they normally have in nasal cannulas. Vitamin D, this was the only medication my patient was on, and it helps promote lung development in premature babies. It's also needed in general for preemies because vitamin D is used to help the body absorb calcium, and a lot of premature babies are vitamin D deficient, and this can lead to developing rickets. So you want to make sure that the premature babies get vitamin D as well. So you would give Lasix to a patient with bronchopulmonary dysplasia that is also fluid overloaded. It's a loop diuretic, and you always want to monitor vitals, especially like their respiratory rate as well as their like O2 saturation, because they're on nasal cannulas, so you want to make sure you're monitoring the O2 saturation to know if you need to increase or decrease. Standard of care, so put on oxygen to maintain oxygen saturation over 95, give quality nutrition and fluids. So many patients are given postnatal steroids, for example, like corticosteroids, which is what they're called, because it reduces inflammation within the lung and lessens mucus production, so it can make breathing easier. And if the patient is fluid overloaded, they are given Lasix. So pain scale, I use the neonatal infant pain scale, which goes from 0 to 7, and it's based on how the infant reacts. So you judge it based on like facial expressions. If they're relaxed, if they grimace, they get a point. Crying is the only one that has three levels, like no cry, whimper, or a vigorous cry. Breathing pattern. So my patient was relaxed, so he got a 0. Cried a little, so he got a 1. Breathing pattern. There was evident changes in breathing. He was doing a lot of work to breathe, and it was very fast. I think his respiratory rate was like 78. He was relaxed in his arms and legs, and he was sleeping most of the time. So the developmental stages for a 3-month-old but 1-week corrected age. So Piaget's stages of development, sensory motor is 0 to 2, and this is developing like coordination and senses of motor and sensory responses and reacting with your surroundings. So when I was doing my head to toe, I would like snap my fingers and he would like look at me and he could follow the light. So that was like basic being like discovering of his senses. He hasn't developed language yet and has not developed object permanence either because he's so young. So for Erickson's stage theory, it's basic trust versus mistrust in infancy, which is 0 to a year. During this stage, development centers around trust and mistrust. For my patient, currently he has spent his whole life in the hospital because he was born premature, so he's been in the NICU and then got moved up to our unit. And there's currently like an unstable family situation, so he hasn't been able to establish trust with any primary caregiver yet, except different nurses that change in and out within their shifts. So he's more likely to develop mistrust currently, since for 3 months he hasn't had like a constant caregiver. So for nursing diagnosis, my first one is impaired gas exchange. Impaired gas exchange related to ineffective breathing patterns, as evidenced by altered respirations, rhythms, tachypnea, and altered respiratory depth. My second one is ineffective breathing patterns related to body position that inhibits lung expansion, as evidenced by tachypnea, nasal flaring, and using accessory muscles to breathe. So for the impaired gas exchange, um, assessment considerations, you want to monitor the O2 level, monitor work of breathing, assess respiration rate. For ineffective breathing pattern, the assessment considerations are very similar. You want to auscultate the lungs, you want to assess respiration rate, you want to check the use of accessory muscles. Nursing interventions, so for impaired gas exchange, you want to suction out the nose because this clears out the secretions, and with the nasal cannula in the nose also, that just helps get the oxygen. You want to monitor arterial blood gas for changes. This makes sure that there's no hypoxia or acidosis, and you would know if you need to increase the oxygen going through the nasal cannula. So for ineffective breathing patterns, you want to auscultate the lungs and areas for decreased ventilation, because you would hear that, and then you could change your plan and possibly put your kiddo on different medications if needed, or on medications. You want to ensure there's no signs of cyanosis by observing nail beds and lip color. Again, that shows that you would need to turn up the oxygen or like assess how much oxygen your baby is getting. So family considerations. So consults, you want to make sure they would consult pulmonology and have a pulmonologist. And they also would want to follow up with social work because there's been a custody battle with this current case. Teaching priorities would be stressing the importance of the nasal cannula and oxygen and monitoring the oxygen saturation. When to seek further medical attention, if you see like the nail beds turning blue or blue in the face or anything like that, you'd want to go to the hospital. You'd also want to see if the work of breathing is a lot, like if he's using his whole body to breathe, like he had been at points in the hospital, and if the oxygen saturation drops below 93. So family concerns, there's an ongoing custody battle, and also being able to take care of 2 young children with BPD because his twin has it also. So just making sure that she has everything she needs to take care of 2 children with this, and that we're supplying all the help we can. And these are my resources. Thank you so much.